This meeting of the Health and Human Services and Veteran Standing Committee to order. We will start with a pledge of allegiance. I don't see Don, so Ken, would you lead us in that?
I pledge allegiance to the flag of the United States of America, the flag of our sustainers. It is a law, duty and justice for all.
Okay, thank you. Do we have proof of notification? Okay. All right. I will need a motion to approve our 19-point agenda.
So
Wait, sorry, I stated that wrong. 21-point agenda.
All
All right. Ken moves. Do I have a second?
second. Okay, go ahead, Cindy. Go ahead.
We'll do ladies first. So Cindy Chicker, seconds. All those in favor, please say aye. Aye. Okay, so we have a public hearing tonight. And as of right now, I don't see any members of the public, although any committee member or anyone in the room can speak as a person of the public. So just to kind of refresh why we do this, this is to get comments from the public regarding the services and programs that the Health and Human Services provides to help us develop our next budget. So that would be the upcoming in 2024 budget. So if there is anyone who wants to speak, we'd have you guys probably come up to a mic and share, and then identify yourself and any organization if you represent an organization. And then we'll conclude that once everybody from the public has had a chance to speak. So is there anyone in the room or online that wishes to speak as a member of the public tonight? Okay. All right. Well, not hearing any requests for that, then we will conclude that portion of the meeting and move on to agenda item number 7, because that takes care of 5 and 6. So hopefully y'all had a chance to read over last month's minutes. Does anybody have any comments or corrections that they noted? No. Okay, then I'll take a motion to approve those.
I so moved.
All right, Mr. Brathwaite moves. Do I have a second? And Mr. Van Landijk. Okay, thank you. All those in favor, please say aye. Aye. Any opposed? Okay, next we have our 2023 VSO budget summary. Ms. Knock is here. Welcome back.
Yes, thank you.
Departments?
It was incredible. I'll cover that more when I get to my
Okay.
administrative report. But if anyone has any questions about the budget statements.
So that would be the documents under 9, and then I know it's not budget, but we also have her number 10 has the copy of calls and walk-ins and
The
forms.
quarterly report, correct?
Yes. So does anybody on the committee have any questions for Ms. Knock? Okay.
So 10 again is the calls and walk-ins reports that I share with you quarterly. We had a big jump for the first 6 months. Again, this PACT Act that came out is making a big splash.
Could you remind us again what that is?
It's it included 3 new conditions to the presumptives for Agent Orange, and it also included, I think it's 12 to 20 for burn pit exposure for the younger generations that were in Iraq and Afghanistan, Southwest Asia, including Desert Storm. So they're making a big push to have everybody file before August 8th. That's never going to happen, but they're trying to get the word out. They've started a big campaign online, and they're starting to host in-person events at the VA clinics and hospitals to try to get more education out there. Later in a couple months, when I go on the radio, I'll be doing the exact same thing, just trying to push and educate so everybody can know. So, and I think that's a big part of it is because everybody wants to know, hey, I heard about Camp Lejeune. It's been around for years, but they're so busy publicizing it right now is when everybody's starting to find out. So, yep, that's the calls and walk-ins log. And then the forms, every month is hit or miss. There's just no predicting the weather, like the storm that, or sunny skies, in my office. So, we did go to conference. It was a national conference and it was amazing. We learned they had so many officials from DC come down, so many secretaries. The place was just buzzing with officials. So it was very educational. And it was nice to be able to get to ask questions to different departments that you've only ever thought of before, so, or submitted paperwork to. We're still going on with our office review for all of the care of graves covered under 45.85. And we're still making our rosters. And we've started budget for this year. I have put together my proposal, but it's nowhere near finished. It's very penciled in right now. So by next month, and by next month, it would be completed, but hopefully will have a copy to you by the 21st of this month.
Thank
One
you.
question.
Yeah, Ms. Reuters.
Actually, in this chart right here that we're looking at, I was actually looking at this earlier today, and I noticed like there's no key to the chart. So I was wondering what is I noticed there's slashes in some of the boxes, and then there's the green and black.
Yep, sorry. So the green are weekends.
Okay.
The black are non-existent days of that month. So the days that have 30, you'll see that black, but if they have 31, they go all the way through. And the slashes means that's the day that we were out of the office. It was either closed or we were away for training. I apologize. I can make that better before you next month. Yep, I can do that.
Any other questions for Ms. Nuck? All right, thank you.
Thank you.
So that takes us to our consent items 11, 12, and 13. And I know Director Clements mentioned we might do a little bit more of an overview on this as this is Ms. Tasha's first meeting with us. Welcome, by the way. So I'll turn that over to whoever you want to speak. Yeah. One of you two. Which actually, now that I see that, that's number 11 on our agenda, isn't it? And I don't know if I see it. Did it just not update?
Yeah, I know.
On it.
Do I not have number 11? I just updated this. Sorry.
Oh, I don't know.
See if it resyncs it. Oh, there, now it just showed up. Okay.
So is this 11? I don't know.
Yes.
Vouchers is 11? Okay, all right.
Yeah, it is. Mine just for some reason
Nope,
hadn't.
that's
pulled
okay.
in.
So I'm not gonna go into any detail on the vouchers with everybody unless you guys have specific questions for me, because what I do monthly, just so you all know, is I do go through those with the county administrator, usually the day before this meeting, and they all get approved. So I kind of went through this already with her, so unless she really wants me to go through such exciting stuff again. Okay. And then what is next is it
Budget.
the budget or the placements, or either? Doesn't matter. I think they're the same, right? I think they're in one. I think budgets are they two separate?
It's kind of all linked, but budget comes up first in our packet.
Comes up first in your packet? Okay. So for July, we should be, or for the end of June, so this is through June 30th, pull these reports on the 5th of July. We should be at about 50% utilization. So, on the left-hand side of the sheet is each of the different units in Health and Human Services, Administration, Public Health, ADRC, Aging and Disability Resource Center, Economic Support, Child and Youth Services, and Behavioral Health. So then the first column is our actual 2023 budget amounts, or not the first column, but you can see the totals in our 2023 budget depending on the different expense areas that we have. And then we have the actual. So that is, like I said, that's the actual as of July 5th. And it's kind of nice to kind of see where we're at as far as where we're at with the budget. For administrative services, you'll see for staff, we're at 37.5%, where we should be at 50%. The reason for that is we lost our admin and building manager, and we were not able to replace that. So that's going to trend low for the rest of the year. And building and operating costs are high. That's high because I double checked this. All of our like insurances, workman's comp, all our liabilities, all that hit the books January 1st or January. So throughout the year, that should true up with where we're at. So if there is some sort of strange expense, I'll let you know if something comes up. Just a quick note here too, that should still stay on even though we made the changes with the maintenance department, because we're still partially funding those positions. So that's still coming out of our budget. Public health, they're only at 29.6%. As you know, we have just Brandy. So with Rose leaving and then we lost Carlene, so that's just gonna be low for a while. Also too, one thing we had in the budget is we had some expenses on our COVID ARPA side for all of our COVID work that we were doing, contact tracing. We budgeted for quite a few contracted staff to help with clinics and things like that, and we're not doing those either. So that's going to look low probably for the rest of the year. The Aging and Disability Resource Center, we have elderly services, which the bulk of that is our transportation program. I know that's slightly low. I'm not too concerned at 41.3%. I took a peek before coming here. Our mileage reimbursements for our volunteers is a little bit lower than anticipated at this point in time, but of course, next month that could, change. And the nutrition and the resource center are pretty close to 50%. No issues there. Economic support's 41.6%. We have a couple of vacancies there, but I'm not too concerned about that. We're getting ready to fill one. So that should trend good the rest of the year. Child and youth services, children and youth programs. I took a peek before that. We do have an unfilled social work position. We have a family preservation position that's been unfilled so far. And then CPS contractual services, that's where we put our budget in for our kinship care payments. And that's also where we budget for things like if we have to do any TPRs and things like that. So we haven't, we've been underspending there as well. And behavioral health unit, lots of programs in that unit. I didn't add them all up to see what they are by themselves as a percentage utilization. But I will say overall we've been kind of doing some restructuring. It's been really hard. We've had some vacancies, some staff turnover. We try to fill those as fast as we can. I did take a peek. One thing to note for the behavioral health clinic too is sometimes the bills that we pay, therapy services that we pay for, our providers, our CCS providers, we pay their invoices. Those are usually about a month behind. So like we're just now paying. So really they're not 50% anyway. They'd probably be more at 42%. So I would say that's probably the big thing there. So that's just where we are with our expenses. So then what I do is it's a little hard to project. I just noticed I have a typo. I didn't say through June. They're at the top in the middle where it says core budget balance. So what I do is I plug in all of the revenue we've received so far, and then it's a real guess as far as anticipated revenue. I can let you know what I put out there for claims, things like that. But like, for example, economic support is in this anticipated revenue or income maintenance. Yeah, economic support. I just got reimbursed for January through May in July. So me trying to guess where the revenue lies is going to land is really hard this early. And then the same for anticipated expenses, right? I'm saying, okay, well, some of our expenses haven't necessarily shown up yet. What might they be? And so that's kind of where those land. So if you just look at just those two pieces and me trying to anticipate those things, It looks like we're a little bit over budget by about $197,000. Now, this is something Candace will get a kick out of. You see this chargeback down at the bottom. So this is related to our placement funds, our Fund 44 and Fund 54. When we have people that have to, are chaptered as we call, and they have to go to like Winnebago or Mendota or someplace like that, those are state-owned, state-run facilities. So when I submit a claim to the state for reimbursement out of our state and county allocations, they hold back what we owe them for those stays, right? So that all gets, basically, they withhold that money, so my revenue looks less for my core budget, which is my Fund 56. I say ours, it's not mine. So so we try to show the picture of what would our budget be if we took that money from Fund 54 and gave it to Fund 56, I guess is the easiest way to kind of explain it. And so if I take that money from 54 and give it to 56, that brings us up to about 89,000. But again, it's mid-year, so things could change. A lot of times we get unanticipated revenue, like, oh, hey, here's we're gonna get like an extra $12,000, $13,000 from the consortium for enhanced Medicaid or for random moment sampling. So these are things that we don't know, and we don't budget for necessarily. So that's where we're kind of sitting right now, mid-year. I'm not too concerned right now. Like I said, it can fluctuate. So, any questions about the budget? I know I don't usually go in that detail, but hopefully that was helpful. And then to just go next right on into placements. So like I said, we have the placement funds. There's several different expenses that we take out of placement funds. Fund 54 is for adults and Fund 44 is for children. This is where we note all our expenses. Like I said, if we have any institutional expenses, placements in like Winnebago, Mendota, facilities such as that. Crisis stabilization is, it's what it says is crisis stabilization. So if we have to place anybody in we use Tolarian is who we contract with for most of that. It comes out of there. And then also we have some residential placements that are court ordered. So those residential placements, we also run all the room and board expenses out of this account as well. So this report just shows you the cost of the stay and then what we get reimbursed and the county expenses. For Fund 44, I would like to go yay. Last month I was getting really nervous that we were going to go way over. We were projecting really high for Fund 54, but as you can see for May, we received $103,753 back. So in the same token, they hold back what we owe them. They also credit us when they get payments from insurance companies and things like that. So, so it all works out that way. So that's Fund 54, Fund 44 as children. Hopefully there's like explanations on there, like the institutional inpatient, same kids can go to those institutions as well. They can go to secure detention and we have to pay for that. And then we have, this is also where we have our foster care and treatment foster care placements come out of this account as well. And that is at about 40%, 7%, so that's still under, so yay. But yeah.
I had a question about that. So it's 47%, but that's only through May. So wouldn't that project us to be over? So, and that's probably going to be somewhat consistent because it looks like we have a lot of the same.
Yes, yes, and there might be some changes there. I know we have some changes coming. Trish or Jessica can speak to maybe where that might trend a little bit better as far as the details. I know the numbers. I don't know kiddos.
So one of our high cost placements, he'll be aging out in November. So in middle of November, we won't have his expenses anymore and he'll transition into the adult world through the managed care organizations. So he won't be on the county's budget anymore. But we are also having another young man go into a placement that is a higher cost placement. And there'll be a contract that'll be presented later to you guys to approve in regards to that.
Are we working on TPRs for any of the children in the?
Yes, we have one TPR
That's
in
good.
progress, and that should be termination of parental rights. Thank you. That is in progress right now, so that'll free up a little bit of funds for and I think that one's in a foster care placement. That's in a foster care placement.
Okay.
So that will help a little bit,
A little bit.
just a little bit.
Yes, so yes, you're right, Ingrid, it's a little high, but I'm a positive thinker.
Well, isn't it most years though, that's the flip flop? Isn't it usually the adult placements that are putting us over? not-
Usually,
Yeah.
right.
So it's
What I
just
can do,
interesting.
what I can do too with, and this isn't reflected yet either, there is a pot of money that's available for secure detention costs, but I have to wait and kind of see how the budget plays out and where that is at the end of the year. If there's anything remaining in that pot, then I can take that and put it there. So, try to put it where I can, but yeah.
Questions?
Super.
I guess I have one, and it's just I'm interested
The mic.
this is kind of weird. Interested to find out, I mean, we were just looking and usually it is the adults that put us over. Are there more youth in programs now, number wise, or is it just the cost of, for some of them that are in one of the programs?
Yeah, we have one young man who's a higher cost placement. Yeah, he has greater needs.
Okay, so the contract monitoring report. Were you asking her to talk a little bit? more
Yeah,
about it
Jamie
this
wants to
time?
talk a
Okay.
little bit about that too.
Thank you, Jamie. Yeah, right. Was she concerned? Okay, so our contract monitoring report is a monthly report that we do that allows our managers, supervisors, and committee members know where we are standing with the contracts we have in place for the current year. So each month I go into the county checkbook and tally up all the bills that we've paid for each individual month, put it in our database, which then calculates the percentage we should be at by whatever month we are paid through. I give the report to each manager and supervisor so they can see if they're overutilization for that month or if they're under. And if they're over, we need to start looking at amending that contract to a larger amount, or if we are just going to continue to monitor it and see where it stands. And it kind of goes in conjunction with some of the stuff that Steph was saying. So one of the higher contracts amounts that we'll be phasing out is our contract for Cholita, which goes into our placement report, which is for the individual that is going to be phasing out. Oh, so I'm gonna call you out here, Mr. Renish. Ken was just asking about the Impact Community Planning Group on page 4, but I just realized they were doing the CHIP plan and we should be done, correct? That contract ended the end of May, so we are no longer in an active contract for them. So where it's at is what it'll be. Yeah. Yeah.
There are two contracts in there that we will have to be bringing back to you at some point in time. Number one is Cholita and then Forward Home for Boys. Both of those will possibly go over. But what happens with those contracts, and correct me if I'm wrong, Jessica, is we don't get those updated rates till late November, early December, when the contracts are already created and sent to you and approved by the board. And so it is one of those things that the daily rate is more than what we expected it to be, even with putting in a little bit of wiggle room. So we will need to be bringing those back to you to update a little bit. On the last page, the bindle, I know we talk about this every year because the snow plowing, we do most of that, obviously. The snow season in the first part of the year. So that's at 91.45. Is there a chance, I know we have a little short snow season before the end of the year, like, do we usually go over? I can't remember what we're normally at this point. We haven't, but Steph and I have been talking about
as it gets closer to that season, we may be amending that contract so that we have that cushion in
Yeah.
case we do.
But there's now the maintenance department and that's
Right.
their responsibility, so
That's what I
it'll
was
really be up to Randy to determine, will he continue to contract with Bindle? Will he do it on his own? What will that look like? And I don't think he's decided that yet.
And do those contracts, like, yeah, would that be for the next year or does it go by the season?
I believe it goes by the season.
By the season.
Yeah.
So it would be this.
I looked in the contract was written last year around September-ish.
Okay.
I forwarded all that on to Randy so he can decide if he wants to contract with them for that this year or next year or whatever.
Okay, thank you. Okay, anyone else on the committee have any questions of the consent items? Otherwise, that will move us on to number 14, which is approve HHS contracts, agreements, and amendments.
Okay, so for this month, we have no amendments, but we know that they'll be coming in future months. We have one contract that we need approval for $115,000 to Mo's Transitional Living Center for a child that is being serviced by the Children and Youth Services Unit for group home placement.
And that's the one you were speaking of.
Yes.
Yes, okay. Any questions on that? Otherwise, we'll take a motion to approve it. Okay, Ms. Rudersdorf, do I have a second? Mr. Severson, all those in favor, please say aye. Any opposed? Okay. Approve the Richland County Transportation Programs 2024-5310 operating grant application. That would be Roxanne. Thank you.
All right.
For the rest of
So every year we apply for the 5310 transportation grant. What this grant does is this actually helps us to fund our bus program. And we do not have to use any tax levy at all. We can use our 8521 as match. So this helps us secure more funding for our bus program to be able to provide more services to our community. So the budget is also attached. So by approving this and us applying for this, there's no guarantees, of course, that we will get it because it is a competitive grant, but we have gotten it for the last 11 years. So by doing this, it would help us secure an extra, $30,172 for the program, which will be needed because so far this year, we've seen a 53% increase in the usage of our buses.
Oh, wow.
So, any questions?
You said we have gotten it every year, right? Yeah.
Yeah, I think we started applying for it in 2012.
I'll move for approval.
Thank you. Right, any discussion? All those in favor, please say aye. Aye. Any opposed? Director Clements, just really quick, had a question on that last contract that we just approved with the Mo's. Is that for just the remainder of this year, or does that, okay,
Just the remainder of the year.
okay. All right, 16, creation of the public health specialist, all right? Got this figured out now.
Well, I think so. So as you guys know, we've been really struggling with hiring nurses for the public health unit. Brandy has been our one and only since February. We did approve we have a temporary staff that comes in and helps a couple days a week, and she is helping 1 day a week, helping Brandy, but it still obviously is not enough. So we went and created a public health specialist position in the hopes that this will help us get her some support. The public health specialist position can really do all the tasks except the nursing, anything that needs a skilled nurse. So what we're really hoping for them to do is do some assistance with environmental health, a lot of the animal bites, which has been overwhelming us lately, and really being the lead on the CHIP and the CHAW, the community health assessment and the community health improvement plan. And so we did send this to Carlson Detman. They did place it on a grade I. What we are looking to do is see if we can fill one of the two. So the unit would be a unit of 3. We'd have the public health officer and either 2 nurses, 2 public health specialists, or 1 public health specialist, 1 nurse. So after your approval, this would go to finance and personnel and then would go to full county board because it would be the creation of a new position.
Motion.
Okay, just for discussion, so I think you touched on this when we were discussing what to do about this, but do you feel like we will be able to get applicants with this? Like, has that had a good pool of applicants?
We haven't tried to fill it, but I think
I mean, I guess what I mean is other counties, have they had success?
other counties have had success, and we've actually had really good luck with the applicant pool that we've been receiving lately. And there's been a couple that through interviews, it's like they might be a perfect fit for this position. So I do think we'd have much better luck
Okay,
filling this because it's such a broader range of degrees that the position is requiring.
yeah. Okay, great.
And I think nurses are just paid really well right now.
Mhm. Any other questions? Yes, to Van Landite?
A little bit underneath.
Yeah, my question is, has there been a pay level approved for this particular position you're proposing?
Yeah, so when we send it to Carlson Detman, they take a look at where it should land and where it should fall, and they put it at grade I on the wage scale. Yes.
Okay, all those in favor, please say aye. Aye. Any? We did. Thank you. Any opposed? Okay. Great, that brings us to your report, Ms. Clements.
All right, so in the folder, I once again did all the different unit updates. So if you had any questions on that, you could let us know. And then otherwise, we did, as Karen said too, we've begun the budget process. The first draft of our budget is due on July 27th. So we will be busy in the next few weeks. Extension has moved to our building, and so far things have been going very well. I have not heard that there's been any concerns or problems with it, and it seems like it's been a very smooth transition. Dennis, our custodian, did transition into the newly created maintenance department, and so far also that's been going well. We've been having discussions with Randy about processes and how things should look and flow, and overall, really, it's been going very well. And then we do have 5 new staff starting in the next few weeks. We're pretty excited about that. And like I said, we've been getting really good applicants. It's nice to be able to have to pick.
Does it say in here where they're all,
So it would be a mental health therapist.
okay,
2 mental health case managers, so they would be the service facilitators for our CCS program. And what we're really hoping to with adding the 2 is we have positions contracted out right now through Trailhead, and so many of those cases should be able to come back in-house once they're ready to go. A family preservation worker with the Child and Youth Services Unit, and then economic support specialist. We just extended an offer today and they accepted, so.
good. Okay, any questions? All right, thank you for putting those in written form. That's helpful.
That was
Unfortunately, mine didn't upload before, so I just now I'm seeing it. So I was trying to look through that. I saw too that there was was it this week that it's the economic support specialist
Yes.
week?
Yeah.
Okay.
Is it this week, Brianna? The economic support
Yeah,
specialist
okay,
week?
10 through the 14th.
Yes,
Yep.
yes.
So awesome.
They're really welcome to be have. It's been busy with the unwinding. They've been very busy. And as you can see in there, their call numbers have gone up greatly from last year. And the staff have been doing a great job of stepping up and doing what they need to do and putting in that extra push during the day.
Okay, so for the review of the community health assessment and community health improvement plan, does that be you or Ms. Bree?
That would be Brandon.
It looks great, by the way. I know that was a lot of work.
Thanks, Nicole. Thank you, Ingrid.
Yeah.
So I apologize. I've had a challenging work week, so I do have to rely on my notes. So the two documents, the Community Health Needs Assessment and the Community Health Improvement Plan, which we refer to often as the CHA and CHIP for short. We hired, as mentioned earlier, the Impact Community Planning Group to complete the reports for Richland County Public Health. This process started in July of 2022, and we completed it this spring of 2023. This is a required, these are required to be done minimally every 5 years for public health. So over the next 5 years, community residents and organizations, we're going to work collectively to build capacity, to implement the plan, evaluate the results, and then identify the opportunities for sustainability. So the first document, the Community Health Needs Assessment. The health needs and priorities of the community are assessed through 2 community meetings, and we reviewed data that were collected by public health nursing staff. This data collection process also included like our community stakeholders through community meetings, and so this helped to develop the Community Health Needs Assessment. The Community Health Needs Assessment then drives the Community Health Improvement Plan. So that second plan, the CHIP for short, is driven by that, and we identified 2 top health priorities for Richland County, and those include mental health and substance use. So these are going to be the 2 areas that we focus on. So the specific goals identified in the Community Health Improvement Plan are to improve the mental health of Richland County adults, and number 2, to reduce the binge drinking among Richland County adults. So our plan at Richland County Health and Human Services Public Health, once we're fully staffed, is to appoint a lead person to focus on the work needed to achieve our goals set forth in this plan, and include area partners such as the Richland Hospital and our existing coalitions with like Partners for Prevention. I think the main focus for us would be to build capacity, especially with the help of our existing partners. Our goal is to update this committee every 6 months on the progress of the work that's going to be done on the Community Health Improvement Plan. Are there any questions?
Committee members? Hopefully you guys got a chance to go.
It's a beautiful document. There's a lot of work and review of this document through each step. Our previous health officer had a lot of work that she put into it, our previous staff nurse, Carlene, as well, and me more towards the end. I'd like to mention that a lot of the charts and the data that are in these documents were obtained through work through our own public health unit. So just wanted to mention that.
I want to say I've had the opportunity to go through both the county level community health improvement plan as well as its partner, the hospital's community health improvement plan. And they're both, I think, kept wonderfully brief, but still had a lot of meat in them. And I just admire the skill it took to work with the organization that helped to shepherd both organizations to get that much, to get it winnowed down that much, with still a lot of good and meaningful data and action to be taken. So now we have to really get down to work.
So I did have a question. I was looking over the data. I know you just mentioned where that came from, but on the CHA one initially where it has our population and then the breakdown, I was like surprised to see the numbers or the percentage of our population that's in the
What page are
certain
you
categories.
What page are you referencing?
I'm sorry, it's on 18C, it's number 9. And I don't know, I haven't looked at data in a while. I guess I just thought that we skewed more on the elderly. I guess that the 30% does go from the 50 to 69. But I just thought that was interesting that it's not, we do have a fair chunk of population that's in the, what would you call that? Medium adult age.
Prime.
Prime. But then that insinuates that other ages are not prime, so I don't know. I don't know what the correct term for that is. And the 91% graduate of high school or higher. Is that, do you know where they pulled the, oh, it says right there, source, US Census 2022. So that honestly to me was encouraging.
So I think at a lot of different stages of doing this work, we were all, when we would stop and review and discuss, we were all, I think there were some surprises and some things were more discouraging than others. But,
Mhm.
I agree with you, Ingrid. Some of the things are somewhat encouraging. So I think we're still going to have a lot of work to do to try to get our goals met.
So I guess that leads to my second question, which maybe you already mentioned this, but in that first, so the CHIP plan where it has all those strategies and everything. So how does that look like? What does that look like going forward? Like practically?
I can't give you a good answer right now on that. Again, I think that'll when I'm fully staffed, when I'm able to designate a lead and work with a person, I think that will be a good opportunity to get a good plan in place. And that's where I'd really like to be able to update you in a few months, more specifically how that's going to look.
So
And I think-
basically, is that all falling on your unit?
Not necessarily. Again, we work with our community partners. So
Okay.
the Richland Hospital is a big partner of ours because we did a lot of this work with them.
Mhm.
So it won't just be us. And as I mentioned, I think the building of the capacity and trying to engage other community stakeholders and trying to do some of this work. I think that's our first step.
One thing I found through this process is there's a lot of passionate people in the community who really are invested in the well-being of the community. And so I think once we can get that initial group, I think we'll have the momentum to keep it going and pick a leader for the group and really make sure we're working on some of these things. There were some great ideas that were generated during the meetings.
I think the biggest thing that both organizations that were charged with doing this have to remember is that there are other people, other organizations like the group at Southwest Cap. They have their own special passion, but they're very, very good at being a good resource to both organizations. And it's just remembering that Brandy's not in this alone. There is more capacity, even within the departments at HHS.
Mhm.
Yeah, there was one, and I can't remember which page it's on, but it listed like all of the things that have been going on. And that was an impressive list. I was trying to find it, but I can't.
Starts on page 6.
Of
of
which
the
one?
Community health assessment.
The CHIP.
The CHOP, not the CHIP, the CHOP.
Oh, the CHOP.
The CHOP.
These acronyms, I tell you. Yeah, that's I like seeing that. That was really neat to see all of that put together in one big list. Anyways, all right. Are there other questions from anyone or comments? Again, I just want to thank you guys, you, especially Brandy. I know there was a lot of hard work here and this was a long process. So yeah, we really, really appreciate this and it's exciting to see this go forward. Okay, so the last item, action or item we're going to address is the annual report. I know we talked about this briefly the last meeting, but we're going to have the directors of the departments give just kind of a brief overview of each department. So that packet is in your folder as well.
So, Brandy, do you want to start? Since you have the microphone.
Already on the hot seat.
Sure. So my section of the annual report, we started out mentioning that 2022 still was, we had a continuation of the COVID pandemic, and we thought that was really important to just address and note that. We were still doing a lot of pandemic response as far as testing, the vaccines. We rolled out the booster in 2022. So just to note that was Still really a lot of work that took up a lot of our time in 2022. So the other areas in our annual report that we usually address are communicable disease, which is a usual public health task. It does take up, it's one of those required services, as you can see in the, I won't break down all the statistics, but you know, we do respond to a variety of diseases. Of course, COVID, that disease had to be added. We also work a lot with, we provide TB skin tests to many area businesses and people that just want them. So we saw an increase in that slightly, I believe, in 2022. I believe 2020 through 2022 hadn't seen as many TB skin tests as previous years, but I'm imagining that will pick up again. We also, in 2022, did identify a couple of clients that needed to have treatment for latent TB infection, which we addressed and were successfully able to treat in that year. And then the rabies prevention and control program that has a lot to do with our animal bites. Of note, we did respond to a total of 52 cases for rabies control in 2022. 40 of those cases were reported as animal bites. 8 specimens were submitted for rabies testing. We get a variety of animal bites ranging from domestic animals, and often we do get some bat specimens and things like that that would be more suspicious for rabies that are required to be tested and followed up on. The Maternal Child Health Systems Initiative. This is a challenging area for public health in that a lot of clients now are not usually accepting of these home visits, but we still do respond to referrals. Our biggest referral comes from hospitals, from birth centers. We offer home visits to new moms. We did have 2 clients that accepted home visits in 2022, but there are also clients that we followed up to some degree by phone case management, and they accepted that level. So we'll continue to try to do that work. And hopefully when I do have staff capacity, that can improve, hopefully next year. We're not doing fluoride varnishes right now. The community free clinic, we were still involved with that in 2022. You can see that there were approximately 346 clinic visits on 48 clinic days. The clinic was canceled for 3 weeks in the summer because of staffing issues and during the December holidays. Environmental health, you can see in there Troy Morris. He's our environmental health consultant through our consortia. He serves a 5-county consortia, but he does a lot of hard work when he comes to Richland County and helps us out. We had 217 total contacts for 2022, and 30 of those were visits that we had to make to homes. And you can see on that list the variety of complaints that we are required to respond to. And just to remind you, we are a complaint-driven department. So we distributed radon testing kits. And I believe that's also listed in the data, the number that Troy would have followed up on. Childhood lead poisoning prevention. We had 80 total children screened in Richland County in 2022 by their healthcare providers, and public health does get notified of certain action levels to follow up on for those. And we are required to follow up on those, and we do a lot of coordination with families and healthcare providers on that. Preparedness and response, that was essentially a continuation of our COVID response. So I don't think there's anything additional to report on that. Thank you.
I have one question.
Yes,
Go
ahead.
It was just interesting to me when I was going through all those communicable diseases. The one that I saw that like really jumped last year was the hepatitis B. And I was curious about that.
Yeah, I think that that's interesting. I noticed that too as a staff nurse, because that's I worked a lot on communicable disease. That was one of my big areas as a staff nurse, and we did see a general increase in that. Also Hep C cases. I think those are getting more reported this year. So I don't know what the contributing factor was to that. If it's just that perhaps people weren't tested for a while because of the pandemic and started to get testing again. I really don't know, but. And those Hep B and Hep C cases, we do a little bit more case management. Some of these diseases require very minimal follow-up, and some of them are more of a case management type of follow-up, so.
Madam Chair,
Yes.
you just reported on the childhood lead poisoning prevention. And in that article, it says that there were 80 children that were screened. Of that number, how many were found to have lead poisoning, if at all? I know this has been a big problem in the past, but my guess is a lot of those homes that had that are either been repainted or demolished, so we should have less, I would guess.
Yeah, so Troy had 3 lead visits he had to make, so there's certain action criteria. So sometimes, so 80 reported lead cases, they may be just above that threshold. And there might be some things like nutritionally, or they may be rechecked and then their lead levels will come back down, or maybe they move out of a home and that can affect a child's lead levels. I don't recall in 2022 any critical levels. I mean, those would stand out to me, but I think the 3 that were followed up on that required some greater action, they weren't critical, but they were significantly higher. And through interventions, we were able to reduce those. So I think that's a good.
A little further question then. I understood that when a person ingested lead, that became a permanent part of your physiology for the rest of your life. Is it true that it would diminish over time?
You can reduce your lead levels.
You can?
Yes, you can.
Okay, thank you.
Hey, nutrition.
Yes.
Thank you, Brandy.
All right, so I'm going to do the nutrition portion of this. Even though it's in public health last year, has transitioned to the ADRC, and I was always pretty involved anyway with the budget for nutrition, and we partnered a lot. So we are senior dining sites, I'm not going to go through that first page of just kind of talking about the program. If we look at the next section at the numbers of meals served, we see that we're starting to rebound a little bit from COVID. So last year we still though had fewer home delivered meals. That is because we unfortunately lost a lot of our home delivered meal drivers. So we do not have the capacity to serve as many home delivered meals. That has gotten a little bit better, but that was something that we were still dealing with in 2022. If you look at the next box, then it's our meals served to participants over an 8-year span. And so you'll see that in 2020, COVID had started, and we did see a little bit of an increase there, but then it did drop off through COVID as well. Again, that was just our capacity to be able to serve people. And then we have on the next page the breakdown for each meal site. So for Richland Center, we provided 18,507 meals. Our Rockbridge location provided 1,844, and our Germantown provided 3,319 meals. Our Germantown, I always think that one is interesting to me because they only have one day a week they serve meals out there for a congregate site, and then they do some home delivered meals, but it's a really robust congregate site, so they serve a lot of meals out of there. And then we also do, our meals are served, the way that we get reimbursed for those is through contributions. And then we also have contracts with our managed care organizations. So in 2022, MCO has requested 2,165 meals, which was a decrease of 116 meals compared to 2021. Again, some of that is COVID related. During the pandemic, for a lot of these, we were giving frozen meals and people didn't want those frozen meals. They want a hot meal. So we still see some of those numbers are lower just because we still don't have the capacity to serve hot meals 5 days a week.
Excuse me, I have a question.
Yeah.
Is that on? Hello. Oh, yeah. It is. Is our process for finding drivers intact?
Because I know of two people, my son was one, who never got a call back when they were volunteering for that.
Okay.
So I'm just asking the question.
Mhm.
I'm hopeful that we have a good process in place.
Yeah, if people contact the ADRC, then they should be able to get to who they need to talk to about having that. If they're having issues, I'd really appreciate if they'd let me know, now that it's moved into the ADRC. So generally, people can call, Health and Human Services or the ADRC. They should then be able to talk with the nutrition coordinator, who would then be able to talk with individuals about volunteering. And then if there ever are any concerns with that, they can reach out to myself. You're welcome.
Madam Chair.
So as far as our volunteers, talking about our volunteers, so in 2022, our volunteers donated 2,961 hours of service. And that was helping at the congregate meal sites in 2022. Volunteer drivers used their own vehicles and gas to deliver noon meals to homebound seniors. National Nutrition Month is in March, which is an annual nutrition education and information campaign created by the Academy of Nutrition and Dietetics. And it's celebrated every year in March. So in 2022, the theme for National Nutrition Month was to celebrate a world of flavors. So there was a lot of outreach for that. The nutrition program did a lot of flyers. They went out to the meal sites, talked about different habits that promote healthy eating, explain ways to eat a variety of nutritious foods, and so forth. Senior Farmers Market, that's something that we do every summer. The Senior Farmers Market goes from June through September. And so last year, there were 139 sets of vouchers, which was 15 more sets than the year before. And those vouchers were valued at $25. So that was $3,475 that went back to local farmers within Wisconsin. Senior Farmers Market, you have to use, those have to be used for Wisconsin grown foods. So we cannot, individuals can't use that for food outside of Wisconsin. They can use it at our local senior farmers market. Oakwood Fruit Farm is another place. And we have a list of all the different farmers markets that they can be used at. So, so that is always a really well-received program. And then regional site manager training in November. The required regional site manager training was held with mandatory training being offered and completed by staff. So it was a virtual live training and was sponsored by the Bureau of Aging and Disability Resources, Greater Wisconsin Agency on Aging Resources, and the Wisconsin Association of Nutrition Directors. So that is our nutrition program, if anybody has any questions for 2022.
Sure.
I'll know more next year for 2023.
Madam Chair.
Thank you, Roxanne. Any questions?
Yes, Madam Chair.
Okay, so that takes us to Administration and Building Operations Unit.
Sure, that's me.
And business and financial,
Huh?
all the things.
I am all the things now. So
Madam Chair, I've been trying to make a
all those things.
connection.
No, 2023, I'm gonna figure out a way to, we're gonna just change it. I think years and years ago, used to just be the administrative unit, period. That was it. That's what it was. I feel that's what I'll go back to, but I don't know. That means we have to do, because we're county, we have to do everything formally, right? All job descriptions have to get changed and all those org charts and things. So, but just haven't gotten to that yet. Anyway, but in 2022, we were still 2 units, an administrative and building unit and a business and financial services unit. But a lot of what we do overlaps and we back each other up in several ways in the unit. And I'm not going to read through this whole list of everything that we do, but we're the support staff and perform a variety of duties for the agency as a whole, not just a specific unit. So you can kind of see if you flip it over the page, then kind of kept on going. So you can see our little org chart there. That was just for the administration building operations. I didn't do an org, well, and then there's an org chart on the finance. So that's going to change a little bit, but for 2022, it was pretty much a lot of what we did was really similar to 21. There weren't really any changes into how we operated or the support that we provided. You know, a highlight was we continued to help with the public health emergency you know, as it says here, helping with in-house vaccination clinics, things like that. Did a lot of the print and online media, Facebook, things like that, making sure the community knew to come to us for COVID vaccines and whatnot. And then the business and finance staff, just their day-to-day, they didn't do a lot out of the ordinary, but, you know, did their normal billing and their for the clinic and pay the bills and deposit the revenue and we kind of do all that. Like I said, we back each other up, right? They cross-train and they all work really well together, so.
Thank you. Any questions? Great, that takes us to the ADRC, so back to Roxanne.
All right. Okay, so the ADRC, so that stands for Aging and Disability Resource Center. We are actually the ADRC of Eagle Country. So that served in 2022, that served 4 counties, Crawford, Juneau, Richland, and Sauk. So our local office is, of course, the Richland office, and the people that we serve in our community are people who are elderly, have physical and or developmental disabilities, adults with substance abuse issues, adults with mental health issues, youth with disabilities that are transitioning from children to adult services. So in 2022, the Richland Center office processed over 14,208 incoming contacts. Those are phone calls or walk-in customers. It does not include our outgoing and individual appointments that our staff have. So our key areas of activity, so we have our information, referral assistance, and options counseling. So services in this area provide simple information to providing short-term case management and more. A lot of times these services are provided by phone or by making home visits, and then as needed, more in-depth counseling to discuss options. So in 2022, our information assistance specialist, which that has now changed to ADRC specialists. They change names every couple of years. We'll go back to information and assistance specialists, I'm sure. So of the contacts that we had 4,497 contacts from customers in 2022. And of the people that identified, 66 were elderly, so 60 years and older. 16% were customers with physical disabilities. 6% had developmental disabilities. 14% were customers with mental health or substance abuse disorders. And 6% were individuals with Alzheimer's or irreversible dementia. Consistent with previous years, about 78% of the needs expressed fell into 5 different categories. So financial assistance and support, long-term care programs, home health, home supportive care, housing, residential needs, and transportation. So, and Candace, I'll just, so you understand, I don't know if you're familiar with ADRCs, but ADRCs are that starting point for long-term care services in Wisconsin. So we do all of the initial assessments and enrolling people into long-term care programs such as family care and IRIS. So we're kind of those gatekeepers. So that's the publicly funded long-term care programs that I had talked about. So in 2022, our staff completed 89 functional screens and they enrolled 66 consumers into long-term care publicly funded programs. Our next section is our disability benefit specialist. So they are available to Richland County residents and they work with individuals who are 18 to 59 years old that have physical disabilities, developmental disabilities, and or disabilities due to mental illness, substance abuse disorders, and so forth. They also help people with SSI, Social Security Disability, Medicare, and a variety of other things as well, public benefits. The interesting part for us is the next box. And so in 2022, we actually had a new disability benefit specialist. She had started the end of 2021, so started going through her training. So the state is able to tell us what our economic impact is. And so for 2022, our disability benefit specialist, she assisted 199 Richland County residents in receiving over $409,615. So that's money that comes back into our community. That's about half of what it usually is, but that's what I would expect because we had a new disability benefit specialist and they go through a lot of intensive training. our elder benefits specialist. So she actually works with individuals who are 60 and over. She also assists people with disability. She assists them with their Medicare benefits, signing up for Social Security, appeals for different, it could be medical bills, it could be for Social Security, disability, SSI, so forth. In 2022, our elder benefit specialist program provided a savings to 333 Richland County residents, totaling over 1.5 million. So that's pretty impressive when we look at such a small community and what those are able to do. Another part for the EDRC, or another program that we have, is our early intervention prevention services. So for our health promotion, we get funding through GWAR, which is the Greater Wisconsin Agency on Aging Resources. And these are Older Americans Act funding. And so in partnership with Simon's Recreation, the ADRC provided funding and technical support to be able to hold Tai Chi, Strong Bodies, physical activity for lifelong success, and SAIL classes. These are all evidence-based programs that significantly reduce falls for seniors. A total of 93 seniors participated in the classes last year. And then in 2022, the ADRC itself also provided a virtual Powerful Tools for Caregivers class in partnership with our regional dementia care specialist. Our transition services for youth. So that is another thing that we offer, and that we assist. We start working with youth that are about 17 and a half and transition them from childhood or child services into adult services. Our information assistance specialist is assigned to each client to take the lead in developing and promoting the services. So the activities that we had for the school year from 2021 to 2022 was ongoing provision of information assistance to teachers, specialized options counseling to youth and their families, leadership and participation in the monthly county communities on transitioning meetings, and then ongoing outreach to schools. So we get a lot of our referrals from schools, but we also get a lot of them in-house from our child and youth services and our children's long-term support. Another program we have is the Alzheimer's Family Caregiver Support Program. So in 2022, we actually received $6,098. We were not able to pull down all of our funding because we just didn't have people that utilize the services. We had people signed up, but then they didn't utilize the services. So we actually did not use all the funding. So if we don't provide the services, then we don't pull down all the funding. The next program that I'm going to talk about is our Dementia Care Specialist program. That is actually a regional program for our regional EDRC. We share a Dementia Care Specialist with Crawford County. And so our Dementia Care Specialist is a person employed by the EDRC regional office, and they're responsible for assisting individuals and families living with dementia to continue to be active in their communities. Our dementia care specialist she's fantastic. She is super passionate about what she does. So she provides individual consultations. We do Dementia Live. We have numerous ADRC staff that are trained in providing Dementia Live. So we did some sessions of that last year. We do dementia-friendly training for businesses. She provides a lot of different education, and she also helps to co-facilitate our caregiver support groups. And then she also does memory screens for individuals as well. And then we did have some special events last year with our dementia care specialist program. So we had the play Grandpa and Lucy, and then we also had a play Fortune Cookies, and then also did a community access TV interview as well. So. And then our dementia care specialist, along with the EDRC, are part of various coalitions. Our transportation program for such a small county, I think we have a really robust transportation program. So we have 2 vehicles that we use for bus routes. In 2022, our public transportation program did 1,097 trips, traveling 28,479 miles. This was a decrease from 2019 still, but through the pandemic, we're starting to grow again. And like I said earlier, we've really grown this year. We also have our driver escort program. And so our driver escorts, they did a total of 3,152 one-way trips. They traveled 123,140 miles, and they donated 4,808 hours of their time. And then we have, the last thing I'm going to talk about is our National Family Caregiver Support Program. So we receive funding to support caregivers. So in 2022, we received $12,636, and that was to provide information to caregivers, assistance in gaining access to support services, individual counseling, advice on organization of support groups, respite care, and supplemental services. So lots of stuff in the ADRC.
Wow, thank you. It's great.
Oh, that's right.
Child and Youth Services Unit. Jessica. No, it's okay.
So Child Protective Services, we have our Child and Youth Services team covers child protection, child welfare, and our youth justice population here in Richland County. So the model for practice on that first page of the information, sorry, that's the second page. First is our org chart for the services. Second page is our just child welfare model for practice, which is a state model for practice. So we've just included that so that everybody is aware of that. The highlights that I'll go over are just how many reports that we took in 2022. So we had 273 reports of alleged child abuse or neglect with a total of 449 victims. So you'll notice that many of those means that there's multiple victims or multiple types of allegations associated to each children who are involved in being reported. That resulted in 62 initial assessments or investigations for child abuse and neglect. We further supported 87 families through outreach through child welfare reports. So those reports are reports where they've either come in at risk or they don't meet our criteria for screening in and investigating, but we've still done outreach to serve them. And sorry, there's 87 reports of that, and then 70 which we opened up and offered additional services. So in 2022, we had 2 part-time family preservation workers. We didn't have a full-time position at that point in time. So we were actually able to do a lot more outreach than we normally would with those workers, providing a lot of outreach and support for at-risk youth. Our juvenile justice or youth justice population, we served, so we had 16 youth justice referrals in 2022. 7 cases ended up with supervision and services, and 2 were still pending at the end of that year for determination. The remainder were screened out or had already been open for services, and we didn't feel like it met the criteria to put the youth on formal supervision. So our YES program, the YES program, Youth Empowerment Services, this is a program that we utilize to serve youth who are on supervision, whether it's at-risk youth or youth who are on supervision for youth justice. They participate in community activities, work on social skills. They also do a lot of self-esteem building, and the hours that they participate in this can also be used for community service hours. When youth also participate in this, we can also do referrals to get them, a referral for job employment and those types of things when they've successfully completed the program. Our unit also consists of our foster care and kinship care. So foster care would be licensing foster homes to take placement of children who are in need of out-of-home care. Kinship are those relative licensed foster homes, as well as our long-term relatives who have guardianship of youth. So we do annual visits for the guardianship cases, and then we offer kinship, and then we can also offer foster care licensing to any of the youth or to the families who take placement of relatives. That is Child and Youth Services. Any questions?
Do you have trouble getting foster family?
Yes. It's a nationwide shortage of foster families.
Do you know approximately how many kids we have in foster homes?
Oh, I can probably get you some numbers and things like that upcoming, but I don't know in 2022 what we would have had at that point. I think we've been kind of tracking those in the placement budgets and things like that, so that would get a better idea of what we're at the end of 2022. But if you're wanting some summaries, I could do some summaries ongoing too. Okay.
Yeah, I guess along with that, like you you don't have an approximation of like how many families we have that do foster care?
Right now, we are very much down. Currently, I'm in the process of licensing 4 homes, but we've pretty much lost all of our homes.
Oh, wow.
Or the homes that we have licensed or have been licensing recently are actually transitional homes from relative homes to become foster homes so that they can have additional support and services. Or in order to qualify for termination of parental rights and adopting children, they have to be licensed as a foster home as well. So if they're not licensed as a foster home, they can only go to guardianship. Termination of parental rights and adoption is considered a little bit more permanent from that, can't be overturned like a guardianship could be. So most of our homes that we have been licensing in recent years have actually been relative caregiver placements.
Do you know if you guys have served anybody in that YES program? Like, I mean, how many youth participate in that?
So during the summer month currently, so it's a requirement of any youth who's on juvenile supervision. So that is a requirement, is that they'll participate in individual mentoring as well as the YES program. Currently, we're running a 2-day-a-week summer program, and we're serving approximately 12 kids in that program this summer. We do it a little bit more intensely over the summer months just because there's no school. During the school year, we try to serve them about once a month, and we generally have somewhere between, I'd say, 4 to 8 youth.
Okay, thank you. Any other questions? Mr. Van Landijk.
I have no question, but I have a comment. I want to compliment all those that took the time to put this together. It's very well organized. It's very easy to read. And aesthetically, it's beautiful to look at. I mean, the colors, and it's kind of attractive. It draws you to it. So I think, you know, it's necessary that we thank you, all of you.
Yes. So thank you, Megan. Yes, I would echo that. So I guess one last question for you. Sorry. I'm just wondering, so with the fact that we're really struggling to get foster care homes, what kind of is there like any education or outreach that you try to get people interested in becoming foster care families?
We are trying to focus on trying to utilize our Facebook page to do some additional outreach and things like that upcoming. Ultimately, most of it has been that it's been one of the many, many roles as a manager I have been doing ongoing. So we are training on one of our frontline social work staff to also be able to license foster homes in order to have more than just one person. I would say last year I was on maternity leave, so for 3 months out of the year, no one was eligible to even license homes, between last year and the beginning of this year when I was off. So I think we try to do recruitment. The biggest barrier that we see is that homes generally don't, they would need to meet higher level of requirements for space. So there's a big space issue with some of the places that I've looked at, or backgrounds. Background checks are also the second probably thing that rules people out. We're just not seeing, I've been in child welfare for 11 years here at Richland County, and we're not seeing the level of people who want to be invested. And once we're also seeing a lot of people who are going through the licensing process, but are not understanding the complex needs of children who are in out-of-home care, and just, they'll take placement of one kid and then they'll never take placement of another child. Or you're licensing a home, and because of the complexities of the youth that we're involved in, it's just not feasible to place there because they're a risk to other kids that are in the home, or they can't be kept safely in the community, or they need that higher level of service provision, such as residential care or group homes.
Thank you.
Yeah, no problem.
Okay. Behavioral health units.
So our behavioral health unit is made up of 9 different programs that kind of offer a continuum of care between immediate crisis services to long-term treatment facilities. We have staff that work with youth, adults, addiction, mental health, different types of disabilities throughout all of these 9 programs. So the first program is CCS. that is a fully funded program by Medicaid. It works with those who have a mental health or substance abuse diagnosis, and it helps them be successful in the community. Even if they are in a group home or some type of placement, they're able to still be members of society and not be placed in any form of institution. There's different services, there's mentoring, there's therapy, whatever the needs of the individual is, it's very person-centered. Next, we have CLTS, which is Children's Long-Term Support, and that helps children with disabilities and their families kind of get services and support. CLTS is a mandated program that the counties have to provide, and you can't have a wait list for that program. So in 2022, there was 62 children that were served. We have 3 CLTS providers at the county, and they do a great job. Along with CLTS, we also have Birth to 3, which is early intervention from the time they're born to up to 3 years old. It's another mandated services that we have to have, and our CLTS providers are also our Birth to 3 providers, so they do both. In 2022, they had 43 referrals for Birth to 3, and they served 51 children. The next one is the Coordinated Service Team, or CST. This is a service for those youth with multiple systems. Some of they're involved with mental health, substance abuse, juvenile justice. It's kind of bringing the team to the table and coordinating what works best for them. This is not a mandated service, but and our county provides a 20% match. But in 2019, there were 19 children enrolled in this program. Then we have APS. They help with elder abuse in the community. That can be neglect, financial exploitation. It's another service we're mandated to have, and we have 1 APS worker currently. And then in 2022 was just 1 as well. But there's a chart that kind of talks about the numbers of neglect cases, financial exploitation cases, physical abuse, sexual abuse, emotional abuse. And then we have our crisis services. So each county is mandated to have a crisis program 24/7, 365 for people to call when they're in need, to not only ensure themselves for themselves, but ensure the safety of those in the community. This is something we are required to have because Health and Human Services is a Chapter 34 clinic. In 2022, Crisis provided assistance to 266 individuals. We have daytime crisis and nighttime crisis. So after hours crisis is something we contract with through Northwest Connections. And they handled 311 of our crisis contacts. And our daytime staff had 971 crisis calls. So a total of 1,282 crisis contacts in 2022. Our crisis kind of lines up with our emergency detention. Our crisis worker and Northwest Connections is the one that kind of implement those Chapter 51s, Chapter 55 placements. In 2022, there was only 24 emergency detentions within the county. Next, we have our mental health outpatient clinic. And our mental health outpatient clinic kind of goes with that mental health residential services piece. So our mental health outpatient clinic consists of our therapist, our psychiatrist, our psychologist, and they are doing assessments, doing medication management, offering therapy. In our mental health residential services, that's the adult family homes and the CBRFs that we can help place, like those CCS participants and stuff like that. So we had 11 individuals in placement in 2022, and our behavioral health unit provided psychotherapy to 47 individuals, psychiatric care to 57 individuals, and we completed 16 psychological exams. Another program we have at the behavioral health unit is treatment court, and that is a program to help keep people out of the prison system and really focus on treatment. Our county currently has sobriety court that started in 2017, and then at the end of 2022, we implemented a drug court. So it's a 5-phase program, a minimum of 14 months long. There are in The participants I'm referring to have extensive treatment and supervision throughout this program. The judge, Lisa McDougall, presides over it. It's funded by the Treatment and Alternative Grant through the Department of Justice, but the county does provide a 25% match to that. And lastly, we have our substance abuse services. We have a substance abuse counselor that is funded through the SOAR grant. She's able to provide treatment, education, prevention services to those within the county. In 2022, she served 24 adults and teens struggling with substance use. In addition to just to individual therapy, they were also running some group programs, such as Prime for Life, which is the goal of that is to help kind of reduce and eliminate that substance abuse. We have the intoxicated driver program through there, where those who are convicted of an OWI have to come get an assessment and do treatment needs. In 22, there was 41 individuals who got those. And lastly, they do choices, which is for underage drinking class for those, and they can kind of get their charges lessened or expunged if they complete this class. And then we do offer detox services. The county contracts with, usually Tularian is where we send most of our people there who detox. I think that's it.
Thank you. That was a great report. I appreciate that. So the IDP clients, like that has really dropped since 2018, and it says that it's mandated. So that just means we have less people.
So my theory is that
That's not good news.
COVID happened.
Oh.
So the bars were shut down. So a lot of people weren't drinking and driving and getting these OWIs.
Gotcha.
And then our judge changed and a lot of the cases had to be postponed and pushed back because of conflicts and stuff. So a lot of them are resolving. So I think that's why the numbers dropped.
So do you think it'll increase then for 2023?
I hope not.
We hope not to.
Yeah,
Right,
I
thank
mean-
you. Well, I'm sorry, were there other questions for her? Go ahead.
I guess I just had one, with respect to use of the SOAR grant, funding, it's for treatment. Anyway, the one that usually gets the cold shoulder is prevention. Anything specifically in the books as far as prevention goes? In the books.
That you're saying that we utilize that for
Yeah.
the SOAR grant.
Yeah, Savannah, our AODA counselor and other AODA counselors, they are a part of the Partners for Prevention. So I know this is the 2022 report, but in 2023, Savannah's partnered with Partners for Prevention to do the Narcan training and other educational things with the police officers at the schools. And I don't know, like financially, that would be a Stephanie question.
I mean, again, Narcan training is not necessarily prevention.
I think sometimes prevention is a hard thing to get to because we're having to react to what we're working with. So that is something, and what's unfortunate right now is, last year we had our individual, she had a lot of time off and then she left. The position was open for a significant amount of time. And then Savannah was hired. She actually is transitioning into the treatment court coordinator position. And so we haven't had stability in that position to really focus on all the different pieces that we need to.
Hey, Economic Support Unit.
Last but not least. Okay.
Definitely.
I think it's safe to say that 2022 was the calm before the storm. About the same number of Richland County residents were served in 2022 as were in 2021, which makes sense because we were still in the public health emergency. Our workers still have high caseloads. The phone calls seemed high, but after the first half of 2023, it's looking as if they weren't really that high. They're getting used. Our staff are half of them were hired after the pandemic began, so they didn't know what pre-pandemic caseloads and work was like. So they're struggling with that. And even our workers that were here pre-COVID are still struggling to get back to that level of hard work that you have to do and a lot of work to keep up with and struggling with not being able to get your work done at the end of the day and having something sitting there when you come back. It's not possible to get it all done now. But I digress. Let's see. The county and consortium exceeded the state performance standards in the answer rate in the call center, the processing timeliness for applications and renewals, which is always good to see. Let's see. Next. So for the whole year of 2022, healthcare eligibility could not be ended due to the pandemic. And so the caseloads just went up since we couldn't, so no one's eligibility could end, the caseloads just went up because more people became eligible. We anticipate that reversing now that renewals are being done. Let's see, the caretaker supplement program, that actually went down, but the state is doing a push for getting potential eligible families to apply for that because they've seen a decrease in kids getting that benefit. Our child care caseload actually went up quite a bit due to the new licensed daycares that opened in our community and county, which is great that we have that. The food share program started to change. Oh, wait, I skipped one. Let's see. Oh, we went from no certified daycare providers in 2021 to one certified daycare provider in 2022. So we're climbing. Let's see. Food share benefits started to go back to pre-pandemic policies in early of 2022. So that started the increase in phone calls and things and started to get the workload back up, starting to what it is going to be. We saw the number of participants go down, but that's really not surprising because there were more jobs and people were able to find work and didn't need the benefits anymore. Let's see. And the front end and fraud and front end investigation. So last year we joined other capital consortium counties by subcontracting with Dane County to do our fraud and overpayment program. They have staff dedicated to this, several staff dedicated to this. And this ensures that a consistent and timely approach to this program, that there is a consistent and timely approach to this very important piece of the public assistance programs. Let's see, marketplace. We did have a certified application counselor for several years. And in the last 5 years, that service has never been asked for. So he did not do the renew his certification for this year, but if someone comes in wanting that service, there are other certified application counselors in the community that we refer them to who can help them. And then for energy assistance, we did administer that program in federal fiscal year 2022, but due to the decrease in funding, we could no longer support a worker to do this program. So beginning in federal fiscal year of 2023, ESI took on the energy assistance program for Richland County. And I just want to add that I'm looking forward to seeing what this report looks like next year for 2023 to see how all the changes are. So that's it.
What is ESI?
Energy Services, Inc.
Where is that based in?
They're all over the state. They run energy assistance programs in many counties. Their office here is in the auditorium. encourage people to become certified and licensed. I don't know the financials of that. I do participate in that program, but we're focusing on getting people licensed and certified. If someone is interested, I have one right now that called me and is interested, and I send out information about it, and we'll get the ball rolling on that. But so there is a push. It's done by that task force. I know that they're doing ads in the paper, they're doing.
Is this something that would be done through your office, or does this include private people that would take children to their homes? Do you have anything to do with them?
I only deal with the folks that want to be certified, so unregulated, I don't deal with them, but I guess I'm not quite understanding what.
Well,
So
yeah, if. Stan.
Okay, I think what you're trying to ask is, what would it take for it to become a home certified daycare, correct? Is that kind of what you're asking? That's one of the questions you're trying to ask us.
So in the state, the state allows two options to be certified, to either be a certified daycare provider, which is done through the county, or to be a licensed daycare provider, which is done by the state. And so when people call us, we let them know that there's both options out there. If they want to be certified, we can take care of that. If they want to be licensed, we get them connected with the state. We do have more licensed providers in our county than we do have certified. Some people really feel with the amount of work you have to go through either process, it makes more sense to get licensed because you do have the option to take more kids. There are individuals in the community who just do daycare on their own without being certified or licensed. That's something that we don't regulate, we don't monitor. I do believe that the state does look into those if there are reported concerns that somebody is taking care of more children than what they're supposed to be.
Yeah, because there's a family that I know that does take them in, and I believe they all operate under certain regulations. But between those that are willing to take children into their homes and other places that would provide services for them, I think, no matter which way, this is something that is extremely important, because we've got an aging community, but for those younger people that come in to work, we really need to provide for them the ability to get their children taken care of.
Sunshine and Giggles opened up in the last year, I believe, and they're right over by Schreiber's.
Yep.
And so they can take a lot of children there. And so they took an old school and converted it into a licensed daycare center, and I think that's been going fine.
Yeah, that's been great. Yeah, the old Lincoln School, it's been great. Yeah, the only thing with the in-home daycare and just having people take them in is that if people are looking to receive funding or some sort of subsidies
share.
for it, then they have to have it be licensed, correct? Yes.
Yep, licensed or certified, that's correct.
This Mike's. Your mic is Jenna. Is it?
Childcare was an issue that I was working on before I retired from the Counties Association. It's a significant problem nationwide, and getting licensed and getting certified is one issue, but also for the providers, I haven't seen a single provider in my life that does it for the money. They're doing it for the love of the job and what they're doing for the kids. But when in these trying times, especially to try and find people, it's hard to get people that go through and get the certification and do that job when they can go to Quick Trip and other places and make a lot more money. And it's been even a lot worse since I retired 3 years ago than it was when I was working on it then. So it's, and I would also add that in the last 2 years, in this last budget cycle, I've seen more efforts at the state level to increase funding for childcare, but unfortunately, it fell on deaf ears at the state, and none of that went through.
I think that wraps us up, right? Great. Well, again, on behalf of our committee, I just want to thank all of you for all the hard work that went into putting this together and for your presentations tonight. This is always, I look forward to this because it's so, such good information and good refreshers on all of the services that you guys provide and the hard work that you do. And it really gives that great overview of what's going on. So thank you. That takes us to number 20, future agenda items. Is there anything from any members of the committee that you want to see on a future agenda? Okay, if not, that'll take us to 21. We will be back to our regularly scheduled programming next month at 9:30. Thank you again to the staff and board members that came. I know this is an inconvenient time of the day to be here, and I appreciate it. Yes, and Mr. Steep, I did see that you joined us, so it was nice to have you be able to join. All the way from Chicago, right, Don?
He's muted.
Yes, we miss you. Okay, well, I will take a motion for adjournment. I've got a motion and a second here, Mr. Van Landite and Ken. All right, all those in favor, please say aye. Any opposed? Okay, night, everybody.
Yeah.